Dr. Davies, thank you for taking my call. I'm ringing about Mr. Henderson, the gentleman with the chronic lower back pain. The one with the L4, L5 disc involvement we've been managing with conservative strengthening. He presented today with a new complaint, a sudden onset, quite intense, right-sided gluteal ache radiating into his posterior thigh, not past the knee. He mentioned a slight numbness in his foot too. I initially thought piriformis syndrome given the distribution, but the intensity is concerning, and he's unable to tolerate any weight bearing on that leg. It's distinct from his usual axial pain.
Ah, Mr. Henderson. Yes, I recall. So, this new pain. Is it positional or constant? Could it be a flare of his sciatica?
It's constant, Dr. Davies, exacerbated by any movement. And the numbness, while mild, is new. My primary concern is the sudden neurological component, combined with the severe functional limitation. I'm leaning towards a potential disc extrusion now, possibly impinging on the S1 root, given the sharp, lancinating quality. I've advised immediate bed rest and cold packs, but I believe he needs urgent imaging.
Understood, Mihira. The sudden escalation and neurological signs are certainly red flags. I'll arrange an urgent MRI for him this afternoon. Mihira, I want you to know that you are not facing this alone, and that your care team's priority is your safety, comfort, and recovery. You will be closely monitored so that any changes in your condition are recognized early, and if something needs attention, treatment will be started promptly. The healthcare team will use the necessary interventions to keep you stable, manage your symptoms, and prevent complications, while also keeping you informed and involved in decisions about your care. It's completely normal to feel anxious after an episode like this, but please be reassured that there are clear plans in place to support you. Looking ahead, there are important steps that can help reduce the risk of future incidents. Taking medications exactly as prescribed, even when you feel well, plays a major role in keeping your condition controlled. Giving your body proper rest, managing stress, and avoiding known triggers can also make a meaningful difference. Just as important is learning to recognize early warning signs and knowing when to seek urgent care rather than waiting. Mihira, by combining medical support with these self-care strategies, you can feel more confident and empowered in managing your health moving forward.